Hi, this is Chris Barnthouse, your long-term care fanatic. I was going to wear an outfit modeled on the Philly fanatic, but costume designers aren't on the government's list of essential businesses. Who knew? But although I don't have a costume, I can still do this. So why am I such a fanatic about long-term care? Because I believe every American has the absolute right to age with dignity, and the only way to do that is to address the risk of long-term care. But what does that have to do with the coronavirus? Well, give me a few minutes of your time, and I'll explain why the current pandemic presents you an unprecedented opportunity and responsibility to talk to your clients of all ages about protecting themselves against the risk of long-term care. Watch this whole video, and I'll give you some great ideas on how to approach prospects and open cases, not just on long-term care, but on retirement income planning as well. Now, I'm not a ghoul. I'm not saying you should try to profit from the current crisis, but I think this is a teachable moment that, if used effectively, will enable us to help our clients make better decisions about their futures. Here's the United States, pre-coronavirus, with Indiana, of course, being the center of the universe. As COVID-19 entered the country, it didn't spread out evenly. Instead, it centered on various, mostly urban hotspots, including now Indianapolis. But what was the epicenter of each of these hotspots? Nursing homes. Newspapers, and for you millennials, internet feeds are loaded with articles about COVID-19 sweeping through nursing homes across the country, including Indiana. I will tell you, the most dangerous place to be in the United States right now is in a nursing home. But why is that? The reasons are threefold. First is population density. Nursing home residents live very close together. They often have roommates. It is very easy for a virus as easily transmitted as COVID-19 to sweep through the facility. Second, it's a susceptible population. We know that COVID-19 is far more dangerous for the elderly and those with underlying medical conditions. Nursing homes, by their very nature, are overloaded with the elderly and those suffering from underlying medical conditions. The third reason is staffing. Nursing homes are typically badly understaffed, which means caregivers cut corners, and that often leads to cross-contamination of residents. And Indiana nursing homes have among the lowest ratings in the country. Why? Funding. Nursing homes are unable to pay their staff's wages that will encourage quality personnel to take on the physical and mental strain of caregiving. Why? A recent investigative report published in the Indianapolis Star pointed out that billions of Medicaid dollars intended for the care of nursing home residents in Indiana is legally siphoned off by hospitals. This is the way it works. Nursing homes rely on Medicaid to pay for the care of about 70% of their residents. The first funding source is payments which flow directly from the Indiana Family and Social Services Administration to the nursing homes. But that only provides minimal care, so nursing homes receive supplemental funding from the U.S. Center for Medicare and Medicaid Services. But that money doesn't go directly to the nursing homes. It goes to the corporations that own the nursing homes. And in Indiana, 93% of nursing homes are owned by county hospitals. In 2018, Indiana received more than $1 billion of supplemental nursing home benefits. Fully 30% of the supplemental funding provided by the federal government. But little of that money actually made it to the nursing homes. The hospitals were able to legally divert money intended for nursing home care, resident care, to upgrade hospital facilities. The Indianapolis Star estimated hospitals have diverted between $1 and $3 billion from nursing homes to hospital facilities since 2003. The hospitals insist this is appropriate use of the funds because it improves the level of care nursing home residents get when they enter a hospital. I'll argue this practice ensures that nursing home patients will enter the hospitals more frequently and in worse condition. Now, you're probably thinking, why do I need to know this? Because knowing this will differentiate you from your competitors and establish you as an expert who can help your clients make good decisions about their long-term care. But if you give them this kind of information, will they really want to discuss long-term care insurance, since that primarily pays for nursing homes, right? Wrong! Long-term care insurance keeps you out of a nursing home. The main thing long-term care insurance provides is choices. You see, long-term care isn't synonymous with nursing home care. Long-term care is a continuum of care ranging from the most independent to the most dependent. The trend is away from facilities. Most long-term care insurance carriers report 80 to 90% of their claims are for home and community-based services. The same week The Star published its investigative report, USA Today ran a story on how technology will enable seniors to stay home longer. But this technology will only be available to those who can afford it. Those who you help to plan for long-term care will be able to choose to stay at home where they are happier and safer. Those who don't plan and must rely on Medicaid will have no choice but to go to a poorly staffed Medicaid-funded nursing home that in this pandemic have literally become death traps. Or what are we supposed to do, Chris? We don't have quiet care in Indiana. Well, Northwestern Mutual doesn't have health insurance or property and casualty insurance, and you still recommend your clients insure against those risks, don't you? And you still have whole life with ACB, don't you? The current pandemic provides the ideal opportunity to explain both risk of dying and the danger of not including long-term care in a financial plan. Whole life with ACB is the ideal solution for the younger client. For the older client who needs traditional long-term care insurance, there are still some good options. I'll list some of them in an upcoming newsletter, which I should have finished by next week. The bottom line is, when this crisis is over, people will want to put it behind them. Don't let them. Remember the classic statement by Carlos Santayana? Those who fail to learn from history are doomed to repeat it. In your hopefully virtual meetings now and in in-person meetings when they become possible, remind your clients of the number of young, healthy people who thought they were bulletproof, but the coronavirus struck down. Point out to them how poorly funded nursing homes in Indiana are and how that leads to poor patient care. Then show them a plan that keeps them in control of where they live and how they receive care, regardless of economic conditions. Okay, Barnthouse, get off your soapbox. Where's the sales idea? Here's an idea I adapted from a talk by industry legend Van Mueller. Getting in to see older, wealthier prospects is hard. You know that. You need to convince them you have information they need, and they'll only get it from you. You call a prospect you've been referred to. He or she tells you they already have an advisor. Do they? Maybe. It doesn't matter. Your response should be, well, that doesn't surprise me, Mr. Prospect. I'd expect somebody in your position to have several advisors. I'd like to become a resource for you with no expectation you'll ever do business with me. But do you mind if I ask you a question? Have your advisors gone over your Social Security statement with you? Well, they usually have. Sometimes they haven't. Then ask the question they've never been asked. What have your advisors told you about the warnings on page 1 and page 4? Be prepared for a long silence. 99 times out of 100, their advisors have never mentioned page 1 or page 4. Now, you're being a little deceptive because page 1 used to include the dates when Social Security and Medicare are projected to run out of money. It got to looking so bad, the Social Security Administration quit putting it on the statement. You have to go to the Social Security Trust Fund website to get that information now. More on that later. The prospect will usually respond, what warnings? You respond, well, that's a longer conversation than I want to have over the phone, but I'd love to set a time to come shake your hand or bump your elbow and introduce myself and explain those warnings to you. The worst thing that will happen is I'll give you an idea you can discuss with your other advisors. And if you want to have a lot of personal attention, tell your advisor you had a conversation with another advisor. Would you object to that? What reasonable person would object to that? When you meet with your prospect, take 2 things. First, a copy of the Social Security Trust Fund Trustees Report so you can show them when Social Security and Medicare run out of money, and start a discussion about retirement income planning that's not overly reliant on government programs. Also bring a copy of page 4 of a Social Security statement. The upper corner contains this paragraph. Now, it didn't scan very well, so I've written in what it says below. It tells them that Medicare is not going to pay for their long-term care, so they should look at private insurance. What a conversation starter. If you have any questions about the topics I've discussed today, or any long-term care issues, feel free to contact me at any time. I'm always happy to answer any questions you may have. In the meantime, stay safe, and while you're wringing your hands over the pandemic, throw a little hand sanitizer and soap on them.